So let's move forward. Now I'd like to introduce MPH alum Emcee LaFrance and current MPH student Sophia Long, and they're going to talk to us about how to get involved in the SPH mentor program. So why don't we start with introductions first? Can you just tell us a little bit about yourself and your SPH experiences?
Hi, my name is Sophia Long. I'm going to be a second-year PHAP student, Public Health Administration and Policy, and I'll be graduating in the spring. I chose to come to the U because it's a top 10 school and it's close to home.
Hi, I'm Emcee LaFrance. I graduated from this program, PHAP program, in 2006, and I'm now employed at Health Partners Institute, where I lead the Research Project Management Office.
Okay, so why don't we talk about the mentor program here. So can one of you describe what the SPH mentor program is? So let's start with that.
Great. Well, I'm such an advocate of the mentor program that I've actually become the chair of the mentor committee through the School of Public Health Board, Alumni Association Board. I've been a mentor for almost 10 years, and the mentor program has been around much longer than that. We have the largest mentor program in the Big Ten schools of public health, which is quite a significant accomplishment. And last year we had a record number of mentor-mentee matches, and I'm really hoping that you'll join me in exceeding that number this year.
Okay. Can you describe what it is that you do as part of this and what the relationship between mentor-mentees look like?
Me and Amy meet about once a month, or at least check in with each other once a month, and usually we have dinner or coffee, and we talk about how class is going, or work, or just professional development skills. And what was really helpful was that during my job search, she was always looking over my resume and cover letters and helped me prepare for interviews, which I'm really grateful for. So she really helped me develop a lot of my professional skills.
As a mentor, what is it that you're looking for, and what do you get out of it?
Well, it's a great opportunity to keep a connection with the field of public health and to see what people are learning who are just coming into the field, and you can really see trends shifting in terms of health informatics and right now a hot topic of opioid addiction, for example. But more than that, it's really a great opportunity to give back to the university, because I was mentored when I was a student in the School of Public Health, and things that might seem like a really steep learning curve when you're sitting here and classes haven't even started get a lot easier years down the line, even just as soon as you graduate. So the experiences that I've had, I can share things with Sophia that might be valuable to her now that I wished I had known at the time. And it's just been a really rewarding relationship. And in fact, I do want to note that although I think everyone here is probably just a first-year student, you can also join the mentor program in subsequent years of your program. And in some cases, if you have a really strong relationship with your mentor, you can continue that into the second year, providing your mentor agrees.
Okay. Sophia, can you comment on how you went about choosing Amy as a mentor, and any advice that you can give to any of the new students here?
In the beginning of the school year, they do a lot of advertising for the mentor program, and they'll probably link you to the sign-up page. And I think the sign-up page just has questions about what you're interested in and why you want a mentor and what you expect to get out of it. And then they do a pairing, a random pairing, and then you meet your mentor during the mentor kickoff.
So with that, I hope that kind of gives you an initial look at what the SPH mentor program is. Do you have any questions about for these two?
Do second-year students generally continue with the mentorship program with the same mentor or a different mentor, or at all?
They can continue into the second year, and all you need to do is just complete the online application. I believe that application will be live either today or tomorrow through the School of Public Health website. It's very easy to sign up, And the more thought that you can put into what you hope to get out of that program, and the more specificity that you can put in your application, the easier it is for the mentor committee volunteers to match mentors and students, which we'll do, I think, at the very end of this month. So be sure to get your application in early, and that also, as we see the numbers coming in, it helps us know how many more mentors we need to recruit. In terms of continuing with your same mentor, I think that's just a conversation to have in the spring of the year. If you say, you know, this has been a productive relationship, I would really value continuing it. If you're open to that, then when you fill out your application for the second year, please note on your application that you have an agreement with your mentor to pair up for the second year. That saves the volunteer match committee a lot of time. One other thing I would just like to note is that what you do academically is probably about half of what you can expect to get out of this program, providing that you make a commitment to look for opportunities like the mentor program, community volunteer opportunities, community organizations, and that sort of thing. So don't think about just completing the academic portion of your learning. There's really a lot of professional development and networking that can go along with these next couple of years of your life, but you have to be really deliberate in reaching out and seizing those opportunities.
Yeah, I'd like to also second that. That was an advice that I actually received quite late. To me, it was just, let's finish the coursework and we're done. But the importance of networking and getting connected with other people, not only within the university, but also, say, attending conferences, et cetera. Having a mentor really helps with that. Any other questions?
Mentors all alumni from the School of Public Health or other public health professionals in the area?
Yes, the answer is yes. The bulk of our mentors at this point are alums, but anyone can be a mentor who is working in public health, essentially, or has that public health experience.
Okay, so why don't we thank Amy and Sophia for their time and their insight into this.